most healthcare facilities are concentrated within the capital city, because this is where all the resources are, where you can have functional operating theaters and good hospitals. And also within South Sudan, within the country, we can say that there is a brain drain where people come from rural areas. Skilled workers come from, tend to focus on urban areas. So if you go to the peripheries where most of the injuries happen, where most of the gunshot happens, there is no access to healthcare, and that combined with poor transportation system, usually the patient may take up to a month to reach a hospital. They are traditional healers, and they're mainly focused in the peripheries because these are areas where you don't have doctors, so there has to be an alternative. The problem with the traditional doctors is that they don't have the capacity to deal with complicated cases. For example, open fractures, fractures, for example, of the neck, of the femur. These complicated cases, they don't have that capacity to deal with them. So a lot of cases that we receive in our hospitals are cases which were initially treated by traditional bone setters. So if we train them and let them recognize the red flags and refer them, then that will really help us a lot. But this is still an idea that we have not yet implemented, but we're thinking of doing it. Cost of care is a very big barrier for healthcare provision. The laws in the country, says that healthcare is supposed to be free for everyone, but the government does not have enough funds to support this policy. People are stuck in between the government hospital, which offers little for them, compared to going to a private facility, which is quite expensive. So that's a very big problem, and I can say that a lot of people don't have access to healthcare because of cost.